Hello, everybody. Welcome to Remaking Medicine. My name is Emily F. Peters, and I am joining you live on this very rainy Tuesday from here in San Francisco, in the midst of a time that feels pretty intense, to have an incredible conversation about living and working ethically, morally, in a time that feels very overwhelming and sometimes catastrophic, and specifically in healthcare. And so I have my guest today with me, Travis Rieder. Welcome from the East Coast. Would you introduce yourself to everybody?
Yeah, of course. Hi, thanks for having me, Emily. My name is Travis Rieder. I'm a moral philosopher and a bioethicist at the Johns Hopkins University. My primary faculty appointment is in the Berman Institute of Bioethics. So this all makes me sort of a strange bird. You know, my PhD is in philosophy, which is a very abstract discipline. To do your PhD, you cut your teeth on very esoteric sorts of problems. But as I was doing that, I got really pulled towards doing more practical work. And so from like 2011 to 2014, as I was finishing my dissertation, I got really invested in climate change ethics and policy, food and nutrition policy, sustainability, planetary limits, overpopulation, like big structural problems. And so I did a postdoc at the Johns Hopkins Berman Institute of Bioethics, where I'm now a faculty member, and really took my philosophical training and applied it to very practical problems. So for about 10 years now, I've been at Hopkins, first as a postdoc and then as a professor, working on a whole variety of issues, but really two big research programs. The one is the sort of catastrophe ethics one, the climate change, food and nutrition, capitalism, sorts of problems in the supply chain, problems that are just so big, you as an individual can't do much about them. And then a separate problem, which is certainly catastrophic, but arose very differently, which is on pain, opioids, drugs, addiction, and North America's drug overdose crisis. So I have a book on each of those topics, and happy to talk about whatever you want.
I'm so excited. Last time we talked was a few weeks ago. It felt like maybe a different world. We certainly were having a lot of crises, the opioid crisis, climate change, et cetera, et cetera. We are now potentially in a slightly different version of that world. So I wanted to start with talking about that sort of feeling or trend of powerlessness that sometimes people feel when a catastrophe is so big and it feels bigger than what one person can take on. So tell me about that from like an ethical and moral perspective. Is the feeling of powerlessness, is that necessarily bad? Is there something good in that? Like, how do we feel about everyone, how we're feeling right now?
Right. For me, it's not about being good or bad. It's that our sense of powerlessness raises a deeply puzzling aspect of our moral lives. And that is because when we are caught in big structural problems like, say, climate change, I live my life as an emitter. I emit greenhouse gases just by virtue of living and doing things out in the world in an industrialized nation. And so I'm contributing actively all the time. We're doing it right now using electronics, right? We are contributing to this problem. And the reason climate change is a problem is because it causes harm, right? It's not that the climate changing is inherently or essentially bad. It's that when it does it, so it causes climate disruptions, which are really problematic. So for instance, like mega fires in California. So I feel implicated. I think most of us with any sort of developed sense of moral responsibility probably feel implicated in a problem like climate change because we're contributing. But the powerlessness seems to imply that I can't actually decrease the harm that's being done, right? Cog in a machine of 8-point-some billion people, which has been going on for a couple hundred years since the Industrial Revolution. And the problem of climate change is caused when 3.7 trillion metric tons of carbon dioxide accumulate in the atmosphere and cause dangerous climate disruptions. I can't do anything like that scale, right? And this is so complex. So here's where the puzzle arises. It feels like I should change. It feels like I should do things like not take a private jet for fun, not drive like a ridiculously fuel inefficient vehicle, maybe reduce my consumption in all sorts of ways. But those changes won't make a meaningful difference to the way that anybody experiences the world. It won't decrease harm. It won't decrease any chance of harm. The problem is just too big. Here's our question. Do you actually have a moral responsibility to do anything regarding and that's the central question of the book Catastrophe Ethics. So the new book that came out last year, it says, are you just a patsy if you work hard to make the environment a better place? Are the nihilists right when they're just like, screw it, eat, drink, and be merry? Or is there something that you really ought to be doing with your life?
And not to spoiler alert your book, but did you come out on the side of nihilism? I mean, is it stoicism, maybe somewhat in between, where you do your best, right, in the situation that you're given?
So there is an element of doing one's best, but I think we need to do more work than that. So basically, the way that the problem sort of came to be understood by me is there are camps of people. People really like to sort of fall into the most easy and seductive camps. And so when you start to feel the weight of this challenge, your causal inefficacy against a problem, you can either become a nihilist and say, well, I guess I don't matter. Eat, drink, and be merry. Tomorrow the world's going to burn. Or you can go the other direction and become a purist and say, I'm not going to benefit from the burning of the planet. So I'm going to extract myself from all of these harmful practices. And you may know some purists. I certainly know some purists. Being an ethicist, I'm surrounded by people who think deeply about moral issues, and some of them decide, if animal agriculture is a catastrophic system, then the way that I should address it is to extract myself from it. I should not contribute to animal welfare issues. And so I won't eat meat, I won't eat animal products, et cetera. So you can see veganism as a sort of purity response to the animal agriculture problem. So what does that look like in the climate case? You actually can't be a purist in the climate case.
There's not a perfect way to be the perfect person in this situation.
There really isn't. And so you can sacrifice as much as you possibly can. You can never fly. You can, organize your entire life to be in an area where you can sort of minimize your footprint on the environment. You can give up all of your, what I call climate privilege. So for instance, if I wanted to give up my climate privilege, I would definitely have to move away from the East Coast of the United States, right? You would have to move away from the West Coast of the United States. We're sort of sitting on some of the most, the history of the most wealthy humans who have ever lived to like build up this infrastructure that is very carbon intensive. But you can move somewhere else and you build a life that is sort of minimally impactful. And you would not be truly pure because you're going to have to eat things. You're going to have to be active in some way. But you could be, 1,000 times better than you are now. And so the whole question is, are you obligated to do that, to become 1,000 times better? The purists and the nihilists, you can't see my hands, but they're far apart. And part of my argument of the book is that surely they're both wrong. They're just so extreme. They're unlivable. They're unrealistic. To be a nihilist is completely unhelpful. And, as sort of everyone points out immediately, as soon as you capitulate to nihilism, you're just accepting that, like, well, I'm going to just benefit in all of these ways for the rest of my life. And, our grandkids and whatever are going to live on a torch planet. And I'm just okay with that. That seems unacceptable. But nihilism seems completely unhelpful as well, because you're going to spend all of your moral energy, all of your financial resources, everything that you have to extract yourself from the system. And your extraction is not going to help anyone.
Is not going to make a difference.
It's not going to make a difference. So we have to find something in the middle where you can actually account for what it means to be morally responsible in the face of this problem, but purity isn't the standard. And so that's the sort of journey that I take.
Well, it's so interesting. I'm about to give a talk in a couple months around perfectionism in medical culture. And I didn't realize that the word perfectionism, I thought it was more modern, and it did really surge. It was a modern thing, talking about like industrialization and factories, and like this idea of like we're going to create like this utopia of perfect, efficient, Ford cars coming out the factory. But that actually is way, way older. And it was a religious term. And it was this idea, this debate of, can we be perfect, right? From a theological perspective, is it attainable, as born sinners? Can we attain perfection in our life? And that's so interesting when we think about, the ways that religion and theology really do intersect into our medical culture, so much more than we maybe as modern people think about necessarily all the time. And how this medical culture that we have is so hinged on perfection in so many ways, to me, right? The idea that you're going to be a perfect med student who becomes a perfect resident, who becomes a perfect physician, who every minute of your day, you're hitting your RVUs, you're coding, you're capturing every CPT code and ICD-10 code perfectly, and that patient is reacting perfectly, and they are taking their medication perfectly, and they're acting rationally. And, that this entire system to me seems really foundationally set up on a fallacy of perfection, when like we are much more complex as natural humans and natural human society to ever be able to say that we could create like a perfect healthcare system. Does that come up? Does that resonate with you?
It does resonate. And what's funny is that as a moral philosopher, I would say it's even older. Perfectionism is even older than what you said, because the term perfectionism is used in ancient Greek philosophy.
Wow. Okay. It goes even further back.
Yeah. And so Plato and Aristotle and sort of the great classical virtue ethicists give rise to the language of perfectionism. Of course, they're writing in Greek. And so we're going to get through several translations. But what we now in English talk about as perfectionist is a value theory model that gets picked up by St. Thomas Aquinas. And so this enters the sort of Catholic picture hundreds and hundreds of years later. One of the things that really resonates about what you said about the healthcare system is perfectionism in this sort of philosophical sense implies an objective view where there is a clear, correct answer. And so part of what you're describing is an account of, say, a healthcare system where not only is perfectionism maybe sort of bizarrely unattainable and sort of, a strange requirement to put on a system where there will be lots of people at varying levels of ability. But it's also just the case that it assumes that there's a way to be a perfect doctor and a way to be a perfect nurse. And that seems just clearly wrong to me.
An evidence-based approach where you're never going to make the wrong choice.
Exactly.
Or your patient is never going to fall through in the cracks,
Exactly right. There is clinical judgment, right? There is a need for individualism. There are going to be different patient values being brought to clinical interactions. And so, I don't even know where you would start trying to describe, a perfect physician or a perfect clinician in some other way. Like that's just
right. But it's so fundamentally ingrained into our approach, where hospitals by and large don't have mechanisms for saying sorry when something bad happens, right? We have litigation and we have malpractice insurance, and we have these systems that are supposed to fight against the imperfection, when in reality, hospitals are places where people die. Like that is a fundamental part of a hospital, right? And sometimes people are injured and sometimes bad things happen. And I don't know that we have a system that today is really super capable of having nuanced and complicated conversations about that imperfect world that we live in, right? It seems like we just strive for perfection and then we of course fail. And then everyone just feels bad about it is like what we like, that's the outcome. Yeah.
There's a whole literature on moral distress. And so my colleagues at Johns Hopkins are leaders in this idea of moral distress as an important moral category in medicine. And part of where you get moral distress is the idea that there is a right action or there are better actions, and that the system or structure is such that you can't take it. And so you get moral distress because you're a clinician working in a non-ideal setting. And so, yeah, another thing that's just weird about the idea of a perfect being, a perfect clinician, is that it's ignoring the fact that we're going to have an imperfect healthcare system. We're going to have a healthcare system that's limiting. And in addition to the imperfect healthcare system, we have an imperfect, say, public health system and infrastructure. And so my colleagues worry a lot about things like a patient needs an at-home ventilator, which is a really invasive sort of procedure. Whether or not that's going to work with them depends on their socioeconomic status, the sorts of resources that they have, who's going to be there to take care of them, how far they live from the hospital. Like, there are all of these factors that we would think ideally shouldn't go into whether or not they get a certain kind of care, but of course it does. It doesn't make any sense at all to prescribe a form of care that will not work for a given patient.
Yeah. And it really reminds me of a scenario that we had here in San Francisco. San Francisco has one of the last true charity hospitals. It's an almshouse, essentially, where our most vulnerable citizens come and they live the rest of their lives as residents of Laguna Honda Hospital, which is 750 people. It's been around 150 years. It's incredible. And it actually got shut down a couple of years ago because it wasn't hitting these CMS quality standards that it was supposed to be hitting. And because people were sneaking in cigarettes into the hospital. And I mean, these are our most vulnerable, most injured, sick, and poor neighbors in our city. And they went as far as actually moving some residents out into other facilities who, of course, immediately died because this is like traumatic for them. And then they came and they saved it, and now they're working on it again. But to me, this is the fundamental struggle in medicine of like, we are taking care of people who are imperfect. We are imperfect ourselves. These are not prisons. This is not intended to be a prison. This is not, and now even when you go to this hospital, it has metal detectors at the door, and it used to be very open, and there was a farm that the community could come and be at, and it's all kind of locked down now. And it's just like, is this what we're trying to do, right? Are we trying to do our best, right, in an imperfect world? Are we being complete perfectionists, purists, or complete nihilists, right? And how do we find ways in our system to make some more permission for just the very complex, messy, imperfect humans that we are, right? We need way more facilities like Laguna Honda in this country. And, I think I've been helping an aunt of mine was trying to get into an assisted living facility. And it's like, why we don't have so much more of this in the United States. There's obviously a huge need. We have the silver tsunami coming, but if we approach that from a perspective of this needs to be a perfect facility where nobody who is old and sick and often poor is going to be hurt in that facility or is going to have a negative outcome in that facility, like, of course we can't build more of these, right? And so how do we scale and talk about creating space for imperfect systems in medicine? Have you seen any examples of people who have done this in a way that feels a little bit more tied to reality? Are there examples out there of hope?
Yeah, so because you're speaking my language, right? Working in really problematic, non-ideal systems and structures that often are catastrophic, right? Our public health system is catastrophic in various ways. One of the things I work on is the drug overdose crisis, which is an ongoing catastrophe. And So there are a couple of different things, right? I don't know who your audience is, if a lot of them are actual clinicians or future clinicians. There's a way that you can actually gain agency with a problem by developing skills to
Mm,
actually make a difference. So
mm,
part of that causal inefficacy is that you can't actually make a difference when it comes to climate change. With some of these massive public health problems, you develop the right medical skills, you can't really meaningfully change the massive structural problem, but you can make a difference for someone, right?
mhm,
That's measurable, and so there's clear moral weight in that. And
mm,
so these individual clinical interactions, like working in a facility like you're talking about, you actually are making a difference. And so the game and the deliberation changes in that context.
mm,
The clear good that you're pursuing and promoting. What I think a lot about is very often when we are dealing with these non-ideal settings, the framework that comes to my mind is harm reduction.
mhm,
As I work in the drug and overdose space, I think a lot about harm reduction strictly. So I do
mm,
philosophical and ethical reasoning about harm reduction interventions. But I think a lot of times what we're doing when
mm,
trying to interact with a non-ideal system is
mm,
trying to make uh, any positive change, which is language I learned from Maya Salvitz, a beautiful writer on drugs,
mm,
addiction, and overdose. And so her history of the harm reduction movement, which was a book that came out a couple of years ago, she talks about that the real idea here is that recovery can be any positive change, right? So if you go from 8 bags of heroin a day to 3, and that allows you to gain the sort of stability that means you can keep a job and
yeah,
that you can see your kids, you're still using heroin every day, but that's clear forward progress, right?
mhm,
Harm reduction is sort of account of recovery, is like, this is obviously a step in recovery. And so I think about that broad framework is really
mhm,
applicable to a lot of our public health structure. The exact details of harm reduction don't always apply. So they do with seatbelts, and they do with drugs, and they do with sex education, and they do with sex work. But sometimes the exact structure doesn't apply, and yet we can still think what would be the right thing to do would be to change the system.
mhm,
The right thing to do would be to have a just system where everybody got the care they deserved.
sure,
But that's not going to happen tomorrow. Sadly, it just might not happen, but
yeah,
doesn't mean we shouldn't keep fighting that fight, right?
sure.
And so over here, I got my hand over here. Over here, we've got the causal and efficacy problem because I want the more just system, and it can
Mhm,
make a huge meaningful difference in bringing about that. But I'm doing the work anyway.
mm,
I'm part of this collective, and I'm trying to do the thing. But over here, we've got the world as it is right now, and people are sick, and people are starving, and people are dying, and people are developing addictions, and et cetera. And so we work in our crappy system for any positive change.
mhm,
That's the piece that we're doing to make a difference while we also like fight.
mm.
And so,
Who saves one person saves the world,
yeah,
right?
that's right.
Like,
That's
keep
right.
that going. I like that framework. I mean, I think that's the duality of this moment is, the system appears to be only getting potentially more broken. That's, we're struggling there. But at the same time, there's a lot of really positive change, and there's individual people who are being helped. And so it's not, I think what I hear you saying is it's not the wrong way to think about it, is to think about that one person that you can help, right? Or those 10 people that you can help. And that, you are doing your best in the scenario that you are doing. How do you think we put this more into maybe medical education? How do we change? Because we are training, I mean, things have started to shift, right? I think we have seen a trend towards a more humanist medical education system, baby steps. But, is that a place that you're excited to maybe to shift the culture a little bit? Is that a place where you feel hopeful, or is it in a different place?
I'm not sure hope is. Um,
Yeah.
I have occasionally done small projects and like done speaking for or done collaboration with the ACGME.
Mhm.
I have taught in the Johns Hopkins School of Medicine for particular courses, and largely going back to this, like, you do what you can do, right? I feel like what we have the responsibility to do is to each take our little piece and push from that side. And I am not deluded to thinking that my one lecture a year at the School of Medicine at this one university is changing graduate medical education, but it's got to start somewhere, right?
Yeah.
And so all of us that have the privilege to stand in a place where we can make those individual pushes have the responsibility to do that. So one of the things that I talk about in catastrophe ethics, where we're talking about all these big structural problems, is you're looking for a middle road between that purist and that nihilist stance. And one of the ways that you get there, so we're skipping way to the end, there's lots of moves that get you there, but one of the things that allows you to find this middle road is to identify the pieces that you can do, the pieces that you're good at, the pieces that you have the privilege to actually be able to play a role in. And so they align with your subjective values, they align in your interests so that you won't develop burnout, right? But when the problems are so big, and we didn't talk about this part yet, but there's so many of them, right? Being a purist is that no one's a purist because they all pick their project and then they're violating all sorts of other problems, right? Like, if I'm spending all my time focusing on climate change, I'm not doing very much at all about global poverty. Like, I'm not fixing malaria anywhere.
So where's your tuberculosis approach, right?
Exactly. And so I want to give people permission to chip off the piece that they have the ability, the drive for, the interest in, and the privilege to actually do something about. So one of the things that I do is I talk a lot about climate change because I have the background and the ability to do that. I have the training and the sort of the foot in the door to go, going up to the University of Pennsylvania next week to give a talk, because I have a platform. And so it's a thing that I can do, so I will. But that's the same reason I talk about drugs everywhere, right? Like my drugs book came out, my drugs book. So my book on pain and opioids came out in 2019. So it's in book years, it's like a senior citizen. It's been out for a while. And I still give talks on it because as long as people will invite me to talk about how we can develop a better pain treatment and education system, play that role, right? And so if you have the ability and aligns with your interest and you can see yourself doing it, it seems like a good reason to take that piece. And you don't have to feel guilty that you don't have a tuberculosis plan, right? Like, hopefully somebody else is working on that, but we can't do everything. Your thing or things.
Well, and in some ways, that's such a striking paradox for people in healthcare because we talk so much about the crisis of burnout and moral injury and suicidality among people working in medicine. But at the same time, if you frame it that way of can you help one person maybe every day, right? Can you do one thing that helps somebody? What an incredible, like, could you pick a better place to be working than in healthcare, right? Where every day you could help somebody, you could help someone get a flu vaccine, you could set somebody's arm, you could, no matter what kind of medicine you're working in, you have that opportunity every day. That's such a powerful reframing that I hope everybody in medicine could feel, because yes, you are in a very broken system. Yes, you cannot save everybody. You cannot be perfect. I'm sorry about that, right? But you have more than anybody else, maybe, more opportunity every day to do that good and to help somebody every day. So maybe this is a moment for healthcare right now. We've seen, things are outside of our control, but you can still individually be making good in this current system. And this is a test. Maybe the universe is testing us a little bit to see, can you feel good about yourself and your own ethics and your own morals? In a landscape that feels increasingly chaotic. And people in medicine love tests, right?
For some weird reason.
Yeah. Well, as we start to wrap up here, give us a couple recommendations of things that you're reading or watching or listening to right now that are interesting for you.
Sure. So I don't get to read a lot of fiction because my life is reading nonfiction. And so I have to say I've been really taken in about the last 6 months with short stories of speculative fiction.
Ooh.
And so for folks who don't know, speculative fiction is sort of a broader category than sci-fi. The idea is that a story in speculative fiction should feel sort of 15 minutes in the future. So like the world looks about like this world with one thing tweaked, you
I
know?
love that.
And so I discovered through a friend of mine, Ted Chiang, who's this just gorgeous, gorgeous writer. He's won every award. And he, I think maybe the thing people most know him for is he wrote the short story that the movie Arrival was based on.
For sure, yeah.
Yeah, but he has 2 collections of short stories, and I tore through them recently. Every single one of them is just absolutely amazing and beautiful and thought-provoking. And what's great about speculative fiction is when you build a world and change one thing, it gives you this incredible vehicle for asking, what would it be like if, right?
Ooh, I
And
love
I love it.
that.
So good.
I mean, I was reading somebody writing recently about imagination is the antithesis of nihilism, right? If you can imagine one little thing, right? It's like so much better. You feel so much more comfortable as a human existing in this world, right? That is so great. I'm gonna have to look that up. Yeah.
And the other thing that I was going to mention is a book that I actually read maybe 2 or 3 years ago now. I was privileged. I got to read it in manuscript form to recommend it for an award. And the author is the Stanford, so out your way, Stanford psychiatrist Anna Lembke, who does pain and and her book is called Dopamine Nation. The reason it's on my mind, even though I read it a few years ago, is because she actually was just the subject of the New York Times The Interview podcast.
Oh, yeah.
So it's in my feed, and this last weekend, it showed up as Anna Lembke talking about addiction in the digital age. And so I listened to her discuss it, and it was so inspiring to think about addiction as this real broad challenge that we have as humans. So in particular, Dopamine Nation, the idea is that the world of the internet and social media has become such a dopamine fuel environment that it's really just causing all sorts of problems in the way that we engage with the world. And so the sorts of problems that led some of us to develop alcoholism or opioids or whatever are now causing, in some ways, more mundane, but just everyday, everywhere problems for almost all of us.
Wow.
And as the father of an 11-year-old child, trying to think about like how we navigate her education with the Internet of Things and social media, and then as someone who struggles with this myself, I loved listening to her talk about it. I think it was Lulu Garcia was the interviewer, and they had a lovely discussion. And I was like, I actually am just going to go back and reread that. It was so enlightening, thinking about how we engage with the world. So highly recommended.
Oh, I love that. It will be interesting to see, the early indications with the GLP-1s and the Ozempics having, reducing kind of that different chatters, of course, with food behavior, but also now starting to think with alcoholism, maybe with smoking, if that starts to, does it carry over into things like dopamine and social media? Does it change how people feel? Are people like not on Instagram every day when they're on Ozempic? Will be super interesting to see. And then what does that mean? Is there a shot that cures our society? And we have to take it every month? Everybody? I mean, talk about speculative fiction, right? Like that is like, we are living that right now.
All right. I think we need to write this short story.
Okay. It's everyone is on Ozempic, and it has made us a better society. And what does that look like? That is so weird to think about, but what a fascinating topic. I am so grateful to you for spending some time with me today on a rainy day, talking about theology and ethics and these big, big questions, and the environment and healthcare systems. And I hope that everybody who gets to watch this gives themselves permission to be a little bit less perfect, but to continue to do as much good as they can. And I'm just so grateful. Thank you so much for joining me today.
Thanks for having me. It's been a pleasure.
Wonderful. All right. Bye. Let's see. Can we actually, I think Ember is going to turn us off. Oh, here.